Many menopausal women have started denying their husband's sex, many for reasons best known to them, maybe infidelity on the part of the husband. Hello and welcome to this health information channel with Dr. Abosede Adegbite. I am a consultant family physician and the program is Clinical Next. Today I want to give attention to menopause and sex. Can a menopausal woman still enjoy sex? Many menopausal women have started denying their husband's sex, many for reasons best known to them, maybe infidelity on the part of the husband. But many more are doing it because of the challenges associated with menopause. These challenges are valid, so let's discuss them. A menopausal woman has not menstruated for 12 consecutive months, no bleeding, no spotting for 12 months. It is not a disease condition, it is brought about by age, so it is physiological. What are these challenges? The notorious hot flushes, in which a woman suddenly becomes drenched in her own sweat. She's the only one that is uncomfortable in the room, every other person is fine. It keeps coming in bouts, making you really uncomfortable. You might also have experienced mood swings, poor sleep, poor libido, dry vagina, painful sex, and bruising of the vagina during sex. These and many more are the reasons why some women have said enough is enough to sex. But your decision is killing your husbands slowly. Many of them are only physically present with you, emotionally they are distant. Their minds are far away, they are beginning to give you the silent treatment. Some are hostile, and you are having frequent quarrels. The reason you are quarreling is secondary. The real reason that you're quarreling is because you are denying them sex. At that point, some men simply take new partners. But it is not in your best interest if your husband seeks a new partner. Reason? If he does, and he ever contracts a sexually transmitted infection, you will become an easy prey for that infection if sometime in the future you change your mind and begin to have sex with him again. The reason is, a dry, easily bruised vagina will readily transmit infection. So why allow him to go out in the first place? Help is available. So this session is for couples and not for women only. Please watch with your husbands. If they are not around, forward the video to them so they can also watch. I'll start with the men. And my message to you is, start with an open, frank discussion with your wife. These women are passing through a phase in their lives where they do not even understand themselves sometimes. It is a difficult place for them. What they need is empathy and support from you. Don't judge them. If the tables were turned, you will probably do the same or do worse. So show them tender loving care and compassion. If they sense genuineness, and not that you are only interested in satisfying your own sexual desires and pleasure, you might be able to turn them on again. My message to the women is, you can no longer get pregnant. The object of some women's fear is pregnancy. They don't want to get pregnant and start nursing babies at an advanced age. But you won't. You have exhausted all the eggs that God assigned to you at birth. Every girl is born with a certain number of eggs to be used in their lifetime. Monthly, they lose these eggs and they make babies with some. But at menopause, all the eggs have finished. So you won't get pregnant. But if your period has not ceased for up to 12 months, then you have not attained menopause. So watch it. Make sure that indeed you have attained menopause, so you won't get pregnant. Then sex is a thing of the mind. Be mentally prepared to enjoy it. So it starts with your mental preparation and disposition. If you are mentally prepared, you will be relaxed. But if you are not relaxed, you might have intense pain and get bruised like you are being deflowered all over again. Then get water-based lubricants and use them liberally just before penetration. It helps penetration to be easier and smoother. Don't get oil-based lubricants and don't get anesthetic agents. Those ones are meant to get in the areas where they are applied, and we have them in jelly forms too. Water-based lubricants are perfect. Go to pharmacies around, buy them over the counter, and guide your husband through penetration so he penetrates at a pace that is comfortable for you. If you get constantly bruised in one posture, please change the posture. It should get better. You may also want to consider hormone replacement therapy. Hormone replacement therapy gives you what your ovaries have stopped producing. In the past, women were afraid of using hormone replacement therapy because of the risk of cancer. But the risk is next to nothing now because of the newer preparations that are available. You have skin patches, vaginal rings, vaginal creams, but don't buy them over the counter. See a doctor, preferably a gynecologist, to prescribe them. That way, they'll prescribe the appropriate one for you and will monitor you while you are using them. My message to the couple is you need ample time and all the privacy you can get. You can no longer do quickies. It won't work. You need to take foreplay longer. But this becomes a problem in men who are struggling with subtle erectile dysfunction. That's because the woman needs a lot of time to relax and to be ready. But the man is pressed for time because he fears he might lose his erection. That way, he might hurt the woman in the process. So if you have erectile dysfunction, please see a doctor and get it treated. Increase the frequency of sex. It helps to improve blood flow to the vagina. With that achieved, the dryness and pain that are associated with penetration will be reduced. And people will begin to ask, how often should they have sex? No, I won't give you a figure, but I'll say whatever works for you as a couple is ideal. But the men should not expect what they had when they newly got married. Don't stress your wives. But you won't be doing once in 2 months. With that kind of frequency, you might have intense pain and get badly bruised. So it is important to increase the frequency. You may also want to go for therapy together. Any gray areas that are not covered in this video will be treated during therapy. To conclude, I'll say the men should start with a frank discussion with their wives about what they feel and be ready to show empathy and support all the way. Reassure her you will go all the journey with her. And for the women, you can no longer get pregnant. Be mentally prepared to enjoy sex, you will. Use water-based lubricants liberally. Change posture if you get bruised consistently in one particular posture. Consider hormone replacement therapy. Increase sexual activities. Go for therapy together. Do all of this and give us feedback. Thanks for watching. Please put your comments and your questions in the comment section or on the WhatsApp number showing on your screen. Attempts will be made to answer a few of them. Also like and share this video with all the older couples you know, people that have been married 20 years and longer. They will need it. Let's rejuvenate their love. Please subscribe to the channel and turn on notifications for it so you don't miss any of the videos that are uploaded. Don't forget, good health is great wealth. Don't take it for granted. I'll see you in my next video. Bye.